Patients come to you with a head injury and expect you to know how severe it is and how quickly to treat them. The American College of Emergency Physicians says that the triage process causes long wait times and crowding in the emergency department. Diagnosing a head injury can take a long time, especially when the emergency physician is ruling out life-threatening conditions. Tests such as a CT scan take time that an emergency department physician must manage effectively to optimize resources and patient care. Your decision to use BrainScope 1 will benefit your patient, especially when compared with only getting a CT scan, which exposes the patient to radiation. CT scans are only sensitive to specific types of structural brain injury, most commonly those that involve a bleed. While CT scans are the ubiquitous gold standard for assessment of head injury in hospital emergency rooms around the country, many other traumatic brain injuries are not visible on CT scans. Assessment time for BrainScope 1 can be as short as 10 to 12 minutes or longer, depending on the type and number of assessments selected. And it's all done right in the ED. That means your patients can be rapidly assessed, and if your determination is that no CT scan is needed, discharged quickly, with thorough understanding of their condition. Using BrainScope 1 for all appropriate patients can facilitate quicker patient triage and assessment, potentially shorten the patient time spent in the ED, which can substantially improve patient satisfaction, reduce the back-and-forth patient transfer process, and aid in more optimal use of resources. A CT scan can also be uncomfortable and time-consuming, while the BrainScope 1 assessment is rapid, non-invasive, and patient-friendly, and can be administered immediately without the need to move patients to a different room. Then there's the fact that the BrainScope 1 technology produces no ionizing radiation. A single CT scan, on the other hand, exposes your patient to 400 times more ionizing radiation than a dental X-ray. Patients found to be CT negative are often discharged without evaluation for concussive injury because CT scans are not helpful for physicians to assess concussion due to the limitations of CT technology. BrainScope 1 provides important additional objective information related to concussion. The BFI indicates potential impairment in brain function, which helps inform discharge referrals for further evaluation for concussion or referrals for post-concussion follow-up care. Note that BrainScope 1 is not intended as a standalone diagnostic or to be used as a replacement for a CT scan. But when you do use this medical device as part of your assessment, it can provide important additional objective information to aid in your diagnosis and care path decisions.